I am Dr. Monica Patel, founder of Train for Birth. I wanted to talk a little bit today about the sciatic nerve and what you can do to help prevent sciatic nerve pain while pregnant, as it is a very common symptom. So a lot of it has to do with how you position your pelvis, both in sitting and standing. It can be a tendency when we are pregnant for your pelvis to tip forward, and that compresses your low back. And the sciatic nerve starts in your low back, L4, 5, between those lumbar joints, and then it runs through your piriformis all the way down. And it's the longest nerve in our body, so keeping it healthy is really important. And so if you find yourself tipping forward, what you want to do is kind of scoop a little bit under. It's not a total scoop under, but finding a nice neutral pelvis so that your ribs and your pelvis are stacked together. Okay, so just being aware of that even can go quite a long way. Also, if you're wearing heels, that can tip your pelvis forward, and so you really have to be conscious to stack those ribs and pelvis together. Nerves in general respond to a gliding type motion. Different tissues in our body respond to different stimulus, and because the nerves live inside essentially a very long sleeve, if you glide them within that sleeve, that's what helps them get good blood flow, good nutrition, and therefore not be so irritated and inflamed. So one way to glide the sciatic nerve is to look down at your feet, toes up, and then point your head up and your toes down, like this. You can do this lying down. If standing on one leg is not easy for you, you can do it leaning. But the head motion is important because it stretches the fascia, okay, from head to toe. All right. Another thing that I advise is going into a cat-cow position. So you're here on all fours, your wrists are stacked underneath your shoulders, your knees are stacked underneath your hips, and you can round, look at your belly button, bring your belly button in towards your spine, even if you do have your baby belly, okay? And then just come to neutral. Don't sway your back, because again, that tilts your pelvis forward, okay? So you round, and you kind of tuck under it, and that creates more space in the joints in your back. So it takes the pressure off of where that nerve starts at its origins. Another thing to do is to stretch your piriformis, which a great stretch for that is just here. Okay, you can also do it laying on your back like this. Okay, like that. You're just gently pressing your hand into your knee. Your foot is flexed. All right. You can have someone help you if you need to, and that stretches in through here. I think it's something like 30% of the population, the sciatic nerve actually goes through the piriformis muscle, and so if the piriformis is tight, then that can pinch on the sciatic nerve. Another thing to do is really just keeping your glutes strong, because when they're strong, it helps keep your pelvis level, and it keeps your pelvis from shifting and creating undue tension on the sciatic nerve. So one of my favorite moves for keeping the glutes strong while pregnant is to go onto all fours and then come out to the side and then come up. You want to be very careful, again, not to let your back tilt and compress, so nice neutral spine, and then really slow, your foot is flexed, coming up and over. Like that, nice and slow. And if you do have sciatic nerve pain, you can do it on both the symptomatic and the unsymptomatic side. If your pain is persistent, feel free to reach out and ask me any questions around it so that I can address your issues directly.